Welcome to Heart about everything lupus, where we discuss everything about lupus. I'm Susie van der Walt, or as most of you know me, Susie Eagles Flight. I have had lupus for 18 years, started the first lupus support organization 17 years ago. I'm on the steering committee of the World Lupus Federation. I'm one of the managing members of Lupus South Africa, and I serve on the board of Andrea's Gift. Today we are going to talk about lupus, menopause, and overheating. We are fortunate to live in a day and age when many of us can speak openly about sexual health and well-being, and it's no longer considered taboo to discuss menopause. And unfortunately, because we have lupus, menopause starts early, we'll deal with overheating, and our symptoms are more severe than those that are healthy. So let us discuss what you can expect or are dealing with at the moment. Just a note, I've had 2 strokes, so please just bear with me if I struggle with pronunciation. So, get a cup of nice hot coffee or tea. Put your earphones in, sit in a relaxing chair, and let the 2 of us discuss lupus. Lupus, menopause, and overheating. Menopause is the natural stage in life when a woman's ability to reproduce eggs come to a close, and her ovaries stop releasing eggs. It can be both challenging and yet freeing time of life, and each woman will approach it differently. If you have lupus, it may also come with a new set of troubles. How does menopause present when you have lupus? Menopause occurs in stages: perimenopause, menopause, and postmenopause, with premenopause sometimes added to the sequence. The whole process starts between the mid-40s, mid-50s, and can last from 7 to 14 years. I've started menopause when I was 35 because of all the chemo drugs, and I'm still in menopause, going for my 12th year, and it started very early for me. Perimenopause is the transitional time just before menopause when estrogen levels begin to decrease, and it may occur years before actual menopause, when a woman begins experiencing changes in her monthly cycle. During this time and into menopause, hormone levels, in particular estrogen and progesterone, may fluctuate greatly. Bones become less dense, and women find themselves putting on weight very easily. Symptoms of perimenopause may include spotting, periods that last for more than a week, periods that come closer together, heavy bleeding, period resumes after no bleeding for a year. Hot flashes and flushing occurs because of changing estrogen levels. It is important to know, however, that the use of corticosteroids can also cause hot flashes and night sweat. Vaginal dryness, painful intercourse or loss of interest in sex, incontinence, changes in sleep that may include night sweats, changes in mood, changes in body such as weight gain, muscle aches, and thinner hair. A woman enters the next stage, menopause, 12 months after her last period. During menopause, even though a woman's period has stopped, she may still experience many of the symptoms listed above. After menopause, women enters the last stage, post-menopause, when they can be particularly vulnerable to heart disease, osteoporosis, making it very important to develop healthy habits and talking with a trusted healthcare practitioner regularly. When you have lupus, the symptoms of menopause are surprisingly similar to those of women who don't have lupus. As a woman who has lupus and who is going through menopause, I must say there are days that I cannot distinguish between the symptoms if it's menopause or lupus. And I have seen that there are women with lupus whose menopause symptoms are more severe than healthy women, although it's not said to be so. The role of estrogen in lupus and menopause. Evidence suggests that estrogen levels plays a significant role in the onset of lupus in women. Remember, when you go back to the diagnosis or why you get lupus, that it's not clearly stated, but hormones is definitely one of them. Estrogen is that. Incidence of lupus increase for a woman of childbearing years because of the presence of elevated estrogen. There is actually a decrease in the incidence of lupus in girls prior to puberty and postmenopausal women. Women who take oral contraceptives and even fertility treatments also have an increased chance of developing lupus because of fluctuating estrogen levels. Hormone replacement therapy, benefits and risk. So, HRT has long years been suggested as a huge problem for women who have lupus because of all the side effects. But recently there are new studies that show that HRT helps with lupus women not getting any heart diseases. But that's a whole study that I'm still busy with and will comment on it later on, because I'm still going through the scientific part of this study. And I know that Michelle Obama mentioned this study in her new book because she suffered from menopause terribly and she needed some other way to get out of menopause. So she studied all this. Now, HRTs. Scientists believe that estrogen somehow either regulates the severity of the disease or is a possible catalyst for developing the disease itself. While maintaining those higher levels of estrogen post-menopause may benefit women who have osteoporosis, the increase in estrogen for the general population or post-menopausal women with lupus could potentially be detrimental. So it shows you it's good and bad. In 2012, a study found that while hormone replacement therapy is not significantly increase the risk of severe flare, it did account for a small increase in the risk of a mild to moderate disease flares. So it increases the risk of getting a flare. It is important to note that HRT can also increase the risk for blood loss, breast cancer, and strokes. It's always best to speak with your healthcare practitioner, your doctor, about the risk of HRTs and what is right for you. It can be totally different for all of us because our lupus is different. Recently, it has been proven that HRTs assist in heart health, contrary to popular belief. So it's a hot potato at the moment, and that is why we suggest speak to your doctor, whether it's your gynecologist, your rheumatologist, your urologist, your nephrologist. Let them make a decision which works for you. Natural ways to manage the symptoms of menopause. What I want to say here is understand, just as you can get something to help you with your lupus symptoms, don't suffer in by basically think we have to suffer it through those years. There are things that can work for you personally, and please ask your doctor to help you there. You don't have to suffer, but here are the natural ways in which you can help yourself. There are many things you can do to naturally help manage symptoms of menopause. You may already be practicing those good habits and part of your lupus symptoms management plan. As part of, you drink plenty of water, you achieve and maintain a healthy weight. Because we use corticosteroids, there is weight gain. But I've seen so many warriors eating healthy and then losing weight and staying healthy. Also, drugs like Lyrica, gabapentin, all those, Cymbalta, all those also causes weight gain. But the benefits that we have from them is something that we cannot lose because of nerve pain is very bad when you have lupus and fibro. Diet. Protein helps to prevent muscle loss. Fruits and vegetables help you to attain a healthy weight and can ward off heart disease. Calcium and vitamin D are good for bone and muscle health. Fish oils are rich in vitamin D and can keep your heart healthy. Avoid dietary triggers such as spicy food, caffeine, alcohol, gluten, lactose, which can further exacerbate symptoms like hot flashes and sweats. Avoid processed foods and refined sugar, which can cause inflammation, changes in mood, and spikes in blood sugar levels. Exercise. Acupuncture. Acupuncture has proven to help with hot flashes. Mindful breathing. Being aware of your breath may help limit the duration of hot flashes as well as reduce anxiety. Now, I completely understand, because if you're somewhere and you get this hot flash and your body is sweating all over, it does cause anxiety, because your clothes are now going to be wet and people are going to see it, and you all those, and then just staying calm and breathing slowly. 1, 2, 3, 4 in, 5 stay, 6, 7, 8. It does help the hot flush to go away faster. There are many supplements you can take to help take the edge off the potentially unpleasant symptoms of menopause. As we always caution, speak to your doctor first in order to make an well-informed, healthy choices and to avoid any drug interaction. Menopause can be a positive and meaningful time of life. It doesn't have to be something to fear. Now, in my personal experience of being in menopause for 11 years, there is no positive. While, yes, night sweat and hot flushes are the reality, many women experience a hormonal transition. Not everyone is affected in the same way. If you do experience some of these symptoms, there are treatment options to discuss with your doctor. As an individual with lupus, you may already be able to keep your lupus symptoms and flares to a minimum, which in turn could help reduce symptoms of menopause as well. I must say, my diet, exercises are the two things that has improved my menopause, and there are treatment that does not contain hormones that is effective. So in the whole part of menopause that I want to say, you are going to have menopause whether it starts early or not. It can be 7 to 15 years time. It's terrible hot flashes, changes in mood, weight gain, all those things. But remember, just like with lupus symptoms, don't suffer in silence. Ask your doctor to help you, to whether it is supplement or natural things or whatever, to help you reduce menopause symptoms as much as possible. Lupus and overheating. Has lupus taken away your ability to tolerate heat or cause flashes or excessive sweating? Overeating is one of the most common symptoms that come with SLE. Listen on to find out how lupus can cause heat intolerance and what you can do to keep cool. Now, I've never actually learned this until a few years ago, that lupus also in itself causes certain kind of issues like excessive sweating. You can't tolerate too much heat. I mean, if I get in a bath of too much hot water, it feels like my skin is on fire. Heavy light, even on your good days, your body can't handle light. When you're very cold, and you get cold very easily, if you're not overheating, that cold of weather, your body pains continuously. So there definitely is other symptoms of lupus that is not necessarily named as lupus symptoms, but it's definitely something I have seen other warriors, along with myself, experience. Lupus and overeating. Heat intolerance and overeating are common complaints for those living with lupus. Even my coffee cannot be too hot. Even when the weather is cool and physical activity is low, SLE causes a number of body temperature related effects, from unusual sweating to low grade fevers. Now, the low grade fever is one of the things that I've also only realized in the last few years, is that you may not have a fever according to a thermometer. It may be normal, but your body is experiencing fever. You feel the fever, your heart, your body is aching, all those things, but your fever is just lower grade. That is called a lower grade fever. And sometimes we get dismissed if we have low grade fevers, but you know your body. If you feel feverish, but the thermometer says it's normal, it's probably a low grade fever. If you are heat sensitive, have low grade fever, sweat, and are light sensitive, don't dismiss it. It's all caused by lupus, and you are not growing crazy. What causes overheating in lupus? There are several possible reasons for those with lupus to become heat intolerant. Studies have shown that those with autoimmune diseases have high levels of free radical nitric oxide. Nitric oxide is a chemical that is naturally produced by the body for quickly dilating blood vessels when necessary. If you're hot, your blood vessels dilate, right? This is how nitroglycerin tablets provide relief for those with angina and chest pain. Those nitric acid makes the body and the veins go open, and then it stops the chest pain when you take nitroglycerin tablets. Abnormal high levels of nitric oxide in those with lupus or other immune conditions can make the skin blood vessels dilate, bringing more body heat to the surface. So you have too much of that nitric oxide. Now your blood vessels dilate and heat is produced. And that is why you must remember, when you think of lupus, which is the part of your immune system that's supposed to protect you, that is now turned around and fight every little thing in your body. It fights the blood, the tissues, the bones, everything. So that is why it has the ability to change everything in your body. That's why it can also cause too much nitric oxide. Causing the surface of the body, it is now brought to the blood vessels opens up and the heat is brought to the body's surface, causing warmth, skin reddening, and sweat. It can also been it has also been found that nitric oxide levels peak during high disease activity, flares, and with lupus nephritis. Why? Because inflammation. There's more inflammation. So if your disease activity is high, you're in a flare. Lupus nephritis is the chronic inflammation in the kidneys. All those things can cause a higher level of nitric oxide, which is kind of logical. Heat intolerance and high levels of nitric oxide can also be symptoms of fibro, a common overlap disease for those who have lupus. Environmental factors like unprotected sun exposure for those with photosensitivity caused by lupus, all of us have it. I haven't seen anyone with lupus that has not got photosensitivity. And it can cause the skin to flush and feel unbearably warm. These are often the first signs of lupus itself, a lupus flare, or high disease activity. Other health conditions that cause overheating include vasculitis. A lot of us have this. Night sweats are common with those with vasculitis, primarily when it affects the blood vessels of the nose, sinuses, ear, lungs, or kidneys. Thyroid disorders, having too much of the hormone thyroxine due to hypothyroidism and Graves' disease can make a person heat sensitive. Diabetes can damage blood vessels and nerves that affects the sweat glands. Hormonal changes, estrogen changes from menstruation, pregnancy, ovarian failure, and menopause, and can cause hot flashes, night sweats in women. Low testosterone can also cause hot flashes in men, which can also be a warning sign of a prostate disorder. Nervous symptoms disorders. Anhidrosis or hypodrosis occurs when someone loses the ability to sweat normally. This can lead to overheating. Though rare, anhidrosis can also be a first sign of lupus. And because your body's sweat helps you keep your body cool, and that's a natural reaction in the body. So if you don't sweat or has not the ability to sweat, then it can also cause overheating because your body wants to cool down the whole time, so it keeps on trying to sweat. Medication. Drugs used to treat high blood pressure, hypertension, seasonal allergies, depression can all cause hot flashes and overheating. This is like Lyrica, some antihistamine, your blood pressure tablets, your antidepressants. There are a lot of antidepressants that can also cause overheating. So you can see how many things that you have around you and you experience. It's also sometimes double because you are depressed, you take Lyrica, you are in menopause, all three, which can cause oversweating. Stress and anxiety. Everybody knows that excessive stress and worry can also cause hot flashes, sweating, especially when fear and worry spike. The overheating caused by the disease I've just named. These conditions can be treated with medication and lifestyle changes once diagnosed by a doctor. Keeping cool with lupus. Always consult a doctor to find out what is causing the overeating, whether it's menopause, lupus, medication, whatever the reason may be. Then in the meantime, there are several things you can do to stay cool and comfortable. Hydrate by sipping on cool water as often as possible. With these new containers that can keep water cool, you keep one close to you. Keep skin cool by spritzing with spray bottle or soaking a towel in cold water. a small pie bottle, especially in summer. You can spray over your body the cold drops, that helps as well. And then also soaking a towel. Dress in loose, light layers to peel off or add back on as necessary. Especially because I'm in menopause, I am always in shirts without sleeves, because it helps to dress cool when you have such severe menopause symptoms. Limit sun exposure. Even if you not struggling with overheating, you must watch out for the sun if you have lupus. Stay indoor when the weather is too hot. Turn on a fan or air conditioning if needed. Limit activity, especially in hot weather. Don't try to do too much because you will sweat continuously. I know that. If I'm going to plan something in the hot weather, I know I must dress cool, my hair is going to be wet, so I must avoid seeing people in those times. Avoid alcohol and caffeine. Both of them can trigger hot flashes and reduce stress by seeing a mental health professional to help with worry and anxiety. Yeah, you can easily say stop stressing because it does cause overheating. It's easy to say that, especially because how do you eliminate stress? But yeah, try breathing techniques. Ask the people around you to help you. And yeah, see a mental professional for anxiety. That is a big problem in oversweating. Most of us struggle with anxiety, and it is a big thing, and we have to take care of that mental part of your body too, because it can also become very ill, just like your physical body. If you have lupus, feeling uncontrollably hot, sweaty for seemingly no reason can be miserable. However, once a proper diagnosis is made by your doctor and treatment begins, it can be possible for those with lupus to keep their cool. So, menopause and overheating is very difficult to deal with on top of lupus. But don't dismiss the symptoms. Talk to your doctor so that you can together find a solution. There are treatments for menopause that does not contain hormones and can help with the symptoms. Remember, menopause starts very early because of lupus met. I started at 35. And with overeating, there are also treatments available. If you report your symptoms, your doctor can treat it and you don't have to suffer. That concludes this podcast. Please review it on the platform you are listening on. Leave a comment below on topics you would like us to talk about. If you enjoyed this podcast, please hit the like button, follow us on Facebook and Instagram, and to subscribe to our YouTube channel. Andrea's Gift, Twins and Teen, Lupus South Africa, and Susie Eagles Flight. Thank you for listening, and remember, giving up is not an option. Bye.